Munchausen syndrome, named for Baron von Munchausen, an 18th century German officer who was known for embellishing the stories of his life and experiences, is the most severe type of factitious disorder. Munchausen syndrome, also sometimes known as hospital addiction syndrome or hospital hopper syndrome, is a term for psychiatric disorders known as factitious disorders, wherein those affected feign, exaggerate, or actually self-induce disease, illness, or psychological trauma in order to draw attention or sympathy to themselves. It is distinct from hypochondriasis in that patients with Munchausen syndrome are aware that they are exaggerating, whereas sufferers of hypochondriasis believe they have the disease. Munchausen syndrome by proxy refers to the abuse of another being, typically a child. In Munchausen syndrome by proxy, an individual falsifies or induces illness in another person to accrue emotional satisfaction, this time vicariously. This is a form of maltreatment rather than a mental disorder.
Those with this disorder are not usually actually sick. It's just for the attention of the medical community. Well, I think that we have to further exemplify that point with a video clip, and we'll take a look at that right now.
Julie's secret life is her attraction to hospitals. It started when she was 18 and was hospitalized after being hit by a car. After a troubled childhood, the hospital was the first place she ever liked.
I remember when I went home from the hospital, I didn't want to go. I felt like I was going to cry to leave the hospital. I didn't really know why. I didn't want to leave.
But she began to invent ways to get back into the hospital.
Like I took oven cleaner, rub it on my arms, and get a chemical burn. Put whatever was under the kitchen sink in some orange juice and, drink it to see what happened.
Her first attempt didn't make her sick enough to be hospitalized. Then she tried Drano. That worked.
I was hospitalized more than 30 times. I lost count.
What a destructive disorder this is.
Symptoms of Munchausen syndrome include dramatic but inconsistent medical history, predictable relapses following improvement in the condition, appearance of new or additional symptoms following negative test results, history of seeking treatment at numerous hospitals, clinics, and doctors' offices, possibly even in different cities, and problems with identity and self-esteem. Possible signs of Munchausen syndrome include that the patient may feign illness, such as faking a seizure or acting as if they have multiple personalities. They may falsify lab exams by perhaps adding blood or protein to a urine specimen. They can exaggerate a medical problem, claiming occasional mild back pain is crippling. They may induce an actual illness, injecting themselves or their child with bacteria to cause a raging infection, or they may dissimulate by initially avoiding treatment so that a minor medical problem becomes more serious. Symptoms of Munchausen syndrome by proxy include that the child's symptoms do not fit a classical picture of illness or do not fit together well. The child's symptoms may improve at the hospital but reappear at home. The parent is over-attentive or too helpful. The parent is often involved in the healthcare field such as nursing. In one of law enforcement's most bizarre and baffling crimes, video cameras are helping save lives of victims too young to speak out for themselves. In these disturbing videotapes, infants suffer, but ultimately survive, while the footage becomes an education tool for special FBI agent Larry Brubaker.
For 3 or 4 hours, this is the most caring, loving mother you've ever seen. And then, just like Dr. Jekyll, Mr. Hyde, something happens and that person becomes an abuser.
The strange crime is called Munchausen syndrome by proxy, when parents secretly make their children sick to gain attention or sympathy for themselves. Assigned to the Minneapolis Bureau, Brubaker became the FBI's Munchausen expert, after helping a local hospital investigate a suspected case, and now he uses these videos to educate others. In this surveillance video, medical staff leaves a suspected Munchausen's father with his baby. When he is sure he is alone, the father puts the child in his crib and smothers it until it loses consciousness. After running for help, the father feigns concern, basking in the attention. His parent was convicted of abuse and separated from his child, one of several hundred Munchausen cases uncovered in the U.S. each year. Munchausen parents not only smother their children with their hands or bodies, they also introduce harmful bacteria into their feeding tubes and even tamper with their medication or poison their food. The exact cause of Munchausen syndrome is unknown, but researchers believe both biological and psychological factors play a role in the development of the syndrome. Some theories suggest that history of abuse or neglect as a child could be a factor, as well as history of frequent illness requiring hospitalization as a child. Researchers are looking into a possible link between personality disorders, which are common in individuals with Munchausen syndrome. There are no reliable statistics regarding the number of people in the United States who suffer from Munchausen syndrome, but is considered to be rare. Statistics are difficult to obtain due to patient dishonestness in representation, which also causes diagnosis of Munchausen syndrome to be very difficult. Patients also seek treatment at several different healthcare facilities, which makes collecting reliable data nearly impossible.
I wrote stuff that really happened.
And you'll do anything to get them back.
Any parent would.
And you'll lie if you have to, won't you?
No.
You did, didn't you?
About me doing this, Brittany?
You did lie, didn't you, Miss Jones?
I swear to God, if God struck me dead right now, I did not do what I was. And some way and somehow, I'll prove it.
In adult cases, medical providers suspecting Munchausen syndrome in a patient should consider working with a mental health specialist to help treat possible underlying mood disorder, as well as to avoid countertransference. As with other factitious disorders, the primary psychological treatment of Munchausen syndrome is psychotherapy. This form of cognitive behavioral therapy will likely focus on changing the thinking and behavior of the individual. When treatment is sought, the first goal is to modify the person's behavior to reduce his or her misuse or overuse of medical resources. Once that goal is met, treatment aims to work on underlying psychological issues that might be causing the person's behavior. Once Munchausen syndrome by proxy is recognized, the child needs to be protected and removed from the direct care of the inflicting parent. This affected parent should not be accused directly but offered help. Because it is a form of child abuse, the syndrome must be reported to the authorities, and psychiatric counseling will be recommended for the parent involved. People with Munchausen syndrome are at risk for health problems. They might also suffer from reactions or health problems associated with multiple tests, procedures, and treatments. They are also at risk for substance abuse and suicide attempts. In a case of Munchausen syndrome by proxy, the child can have complications from injuries, infectious medications, surgeries, or tests. Risk for psychological complications like depression, anxiety, post-traumatic stress disorder, and other is increased in survivors of any form of child abuse.